the infections and to social tensions that have led to violence. Unless we counter rumors, conspiracy theories and lies, they will negate our other efforts. The United Nations Verified campaign aims to ensure people have access to accurate advice that protects and promotes health. I welcome efforts by social media platforms and others to prevent the spread of false stories and advice and promote scientific fact-based analysis, although more must be done. Excellencies, ladies and gentlemen, the World Health Summit and the M8 Alliance are important platforms to champion and work together for global health. This gathering, bringing together science, politics, business and civil society, is the place to build new partnerships, share best practices and take decisions that could save lives. Let us use this opportunity to confront the COVID-19 crisis together with the urgency and integrity it requires. Thank you.
Thank you, Mr. Secretary General, for your constant support. Now, ladies and gentlemen, Excellencies, dear friends, it's a great pleasure and a privilege to introduce my good friend and also the patron of the World Health Summit, Dr. Tedros, Director General of the World Health Organization. Dr. Tedros is the first WHO Director General to have been elected from multiple candidates by the World Health Assembly, and he is the first from the African region. Needless to say to this audience that Dr. Tedros probably has one of the most important, but also one of the most challenging positions at the present time. He personally and WHO deserve our full support. Let us listen to his message.
Your Excellency Frank-Walter Steinmeier, Federal President of Germany, Professor Detlev Ganten, Excellencies, dear colleagues and friends, it's truly an honor to address you today. As a member of the World Health Summit's founding committee, and now as one of its patrons, I'm so pleased to see how it has evolved into a forum where a truly diverse group of global health leaders can come together to tackle the tough questions. I'm sad I cannot be in Berlin this year in person, but I'm happy we can convene virtually. We're indeed facing tough questions today. When I had the honor of addressing the World Health Summit a year ago, I spoke about the deficit in political will to act on global health and preparedness. Understandably, perhaps, both seemed like abstract concepts at the time, involving faraway events that happened to faraway people. Well, my friends, global health is no longer in abstraction. From Berlin to Bogota, Minneapolis to Mumbai, Seoul to St. Petersburg, we're facing the same threat, confronting the same difficult new reality. Of course, this pandemic is playing out differently in every country and in every community. But there are some constants. Health systems matter, preparedness matters, and doctors, nurses, and health workers must have the training and equipment they need. These have been fundamental to how countries and communities are weathering this pandemic. The lesson is clear. A strong health system is a resilient health system. Health systems and preparedness are not only an investment in the future, they are the foundation of our response today. Public health is more than medicine and science, and it's bigger than any individual. Ultimately, it's a matter of leadership and a question of political choice. COVID-19 is shining a light on the decisions we and our policy makers are making, not only today, but also in the past. Many of the world's wealthiest countries with some of the most advanced health systems have been upended by this virus. This virus thrives in the inequalities in our societies and the gaps in our health systems. The pandemic has highlighted the neglect of basic health system functions underpinning emergency preparedness to disastrous consequence. COVID-19 has put the spotlight on critical gaps in areas such as surveillance, diagnostics, essential medicines, protective equipment, supply chains, infection prevention and control, water, sanitation and hygiene, and the health workforce. The absence of any one of these leaves communities vulnerable and undermines the timely response necessary to contain the pandemic or any health crisis. But the pandemic has also given us cause for hope, because we have seen again and again that when countries and communities take the right actions, it's never too late to bring the outbreak under control. We know that fundamental public health measures work. Find, test, isolate, and care for every case, and trace and quarantine every contact. We know that we can slow the spread of the virus through physical distancing, masks, hand washing, and meeting family and friends outside. We have to do it all. And across the globe, we continue to see a resurgence of cases when countries reopen their societies and economies too quickly. This is a dangerous moment for many countries in the Northern Hemisphere as cases spike. But again and again, we have seen that taking the right actions quickly means the outbreak can be managed. In the face of this unprecedented threat, leaders must strike a delicate balance between protecting their people and maintaining essential health services while minimizing social and economic damage and respecting human rights. It's not enough to be reactive. We must plan and take action for this pandemic over the long haul. We have to move from ad hoc solutions to long-term planning to protect lives and livelihoods. And the health effects of the pandemic go far beyond the suffering caused by the virus itself. Vaccination campaigns for tuberculosis, pneumonia and diarrhea, polio, measles, and many others have been disrupted, putting hundreds of millions of people at risk. We must preserve and restart our prevention and treatment campaigns and other essential health services with the utmost urgency, while also assuring safe conditions for frontline workers and patients alike. We still have a long haul ahead of us. We cannot slow down and we cannot waver. It's more important than ever that we focus on the elderly and other vulnerable populations who already struggle to access health services, including migrants and other marginalized groups. We have a huge challenge ahead of us, but this is not the first challenge we have faced, and this will not be the last. We're learning the lessons of this pandemic every day. It's up to us to act on them. Last year, and since then, I have spoken many times about the importance of national unity and international cooperation, or global solidarity, of multilateralism and solidarity. Again, the pandemic has made these concepts concrete. They're literally matters of life and death. It's natural that countries want to protect their own citizens first. But if and when we have an effective vaccine, we must also use it effectively. And the best way to do that is to vaccinate some people in all countries rather than all people in some countries. I will repeat. The best way to do that is vaccinate some people in all countries rather than all people in some countries. Let me be clear. Vaccine nationalism will prolong the pandemic, not shorten it. The only way to recover faster, be it lives or livelihoods, is to recover together. This is why President Ursula von der Leyen and President Emmanuel Macron joined with WHO to launch the Access to COVID-19 Tools Accelerator to scale up the development and delivery of safe and effective vaccines, treatments, and diagnostics to the world's most at-risk people in all countries. I also want to specially mention President Macron and Chancellor Angela Merkel, who have increased their commitment to support WHO's coordinating role in the global public health architecture. And I would like to give a special thanks to my close friend, His Excellency Jens Spahn, the Minister of Health of the Federal Republic of Germany, who has been a steadfast supporter of WHO's work and a champion for multilateral action and support for health. Jens, I wish you a quick recovery. Finally, I have the pleasure of announcing that together with the Global Governance Project, we're releasing a new publication entitled Health, A Political Choice, Act Now, Together. It includes national case studies on the response to COVID-19, insights from leaders, and addresses the economic, social, and ecological determinants underlying the pandemic. Excellencies, friends, and colleagues, how we emerge from this pandemic and whether we're ready to take on the challenges of the future depends on our actions today. Working together in solidarity, we can save lives, stabilize health systems, and drive a global recovery. And even as we respond to the current crisis, we have to be planning ahead for the long term. We must learn the lessons of today so that we're prepared for the threats of tomorrow. Vielen Dank. I thank you.
Vielen Dank, Dr. Tedros. Thank you very much, Director General of WHO. We heard your message, and we wish you good luck and courage. And hopefully we will achieve together with you what needs to be done in these challenging days. Our next speaker, Excellencies, ladies and gentlemen, dear friends, is Paul Hudson, CEO of Sanofi France. Paul has a splendid international career in healthcare. The success of the vaccination programs of Sanofi with their partners will be decisive for the course of the COVID-19 pandemic and will be decisive for our ability to treat the disease. Let us hear his message.
Good evening, guten Abend. I'm sorry I'm not able to be with you all in Berlin tonight. Whilst I regret not being with you physically, I'm delighted to be able to share some thoughts for the opening of the World Health Summit, a platform of exchange and conversations that has probably never been so important. The pandemic and related uncertainty we navigate through every day is showing us how vulnerable our interconnected world can be. Such global tragedy calls for a global response and mobilization from all stakeholders, academia, policymakers, civil society, and industry. In this context, and after 30 years working in the pharma industry, I can only say how impressed I've been by the mobilization of all of the health community. As Sanofi and industry, we have a strong sense of purpose to play our part. In the peak of the first wave, and despite the lockdown measures, all of our work has been stripped down to the bare essentials, making and supplying medicines to those that need them and protecting our science so that future life-changing medicines are not delayed. In parallel, since February, we have entered in a race against the virus with the ambition to do something that has never been done, developing a vaccine at an unprecedented speed without cutting corners on safety or efficacy. Multiple vaccines will be needed. The race is not between companies, it's against the virus. And I sometimes said that it is a race that I'm happy to lose as long as we can have multiple vaccines to help the world get back to normal. We are developing one of our vaccines in cooperation with our peer, GSK, tremendous partnership. We'll provide the antigen, they'll provide the adjuvant, and we will leverage a proven and approved platform used for our influenza vaccines. Finalizing our partnership with GSK took us only 12 days, and in normal times it would have taken us months, if not years. Our partnership with GSK exemplifies two essential ingredients of success in the global fight against the virus: speed and collaboration. Since February, we have been constantly engaging with our regulatory authorities to understand how we can accelerate the development of a vaccine by exchanging information in real time. Early in the crisis, we've been able to leverage our relationship with the US agency BARDA to accelerate the development of one of our vaccine candidates. Over the last weeks, we've also been able to conclude agreements with governments of the United States, the UK, the European Union, and Canada for the supply of vaccines should it be proved safe and effective. We also plan to provide a significant proportion of our total worldwide available supply to COVAX, a global collaboration platform which aim to accelerate the development, production, and equitable access to COVID-19 tests, treatments, and vaccines. One thing is certain, we are all taking all the necessary steps to ensure that COVID-19 vaccines will be affordable and accessible to people right across the world. Sanofi Pasteur's motto has been for decades that no one should die from a vaccine-preventable disease. Vaccines is part of Sanofi DNA. Polio, yellow fever, influenza. Every year our employees produce 1 billion doses of vaccines to prevent people catching diseases. COVID-19 gives us one more opportunity to play a key role for public health. As we continue fighting against the virus, we also have a responsibility to continue thinking long term. We must ensure that we don't forget and capture the lessons we're learning in this crisis and how they will inform our future behaviors as a global society. First and foremost, the pandemic has brought the critical link between human health and economic growth to the front and center. As countries around the world start being impacted by the economic consequences of the pandemic, it is fundamental that governments around the world, despite all the headwinds, continue to invest in their healthcare systems and infrastructure. Achieving universal health coverage is part of the United Nations Sustainable Development Goals, but we know that today almost half the world population still lacks access to essential health services. Second, we need to work together to build resilient and sustainable health systems and ensure health security. We have seen tensions between countries on the supply of medical products and equipment at the beginning of this crisis. Our industry has a key role to play in this topic, and during the peak of the crisis, we at Sanofi were able to increase production capacity and secure supply thanks to our global and diversified industrial network. We want to go a step further in Europe, where we intend to create a European and global champion dedicated to the production of active pharmaceutical ingredients. The crisis we face should not lead us to take further protectionist measures. What we need to ensure is building resilience and strategic health autonomy. Last, we need to clearly ask ourselves, what can we learn to ensure that we're never again caught off guard by a new pandemic? Pandemic preparedness was previously thought to be, prohibitively expensive and high risk, but it is now clear that it is an investment that must be made. The human and economic cost of a pandemic is far higher. I was pleased to hear European Commission President Ursula von der Leyen making a series of important announcements along these lines in September, calling for a stronger European health union. And I want to thank her for her leadership. The plan to create a European BARDA is a positive first step. As a key French, European and global company, we will be pleased at Sanofi to collaborate with the EU, the institutions, and everybody supporting this ambition. Addressing a global audience today from Berlin, I know that countries like France and Germany are willing to play a key role in this debate for the continent. The stronger involvement of Europe into global health topics will not only benefit European citizens, but to the world at large. I've never lived through something as disruptive and as brutal as COVID-19 pandemic, nor would I believe that a virus could put more than half of the world's population in effective lockdown. It is too soon to assess the long-term implications that the COVID-19 pandemic will have on how we operate as companies, on the functioning of our healthcare systems, or societies overall. We will get through the pandemic together. And as we continue fighting against the virus, we need moments like the World Health Summit to discuss, exchange, be ambitious about the future of healthcare we want to shape for the next generations. Thank you for giving me the possibility to join such an impressive lineup of speakers. I wish you a very fruitful and productive summit. Thank you.
Thank you so much, Paul. Your success will be very important in order to defeat the coronavirus, and we are looking forward to the promising results. It is now my great pleasure, ladies and gentlemen, excellencies, dear friends, to introduce to you Winnie Byanyima, the Executive Director of UNAIDS and Under Secretary General of the United Nations, a passionate and long-standing champion of social justice and gender equality. Ms. Byanyima leads the United Nations efforts to end the AIDS epidemic by 2030. Ms. Byanyima has been an early champion of a people's vaccine against the coronavirus that is available and free of charge to everyone, everywhere. I personally had the great pleasure of meeting her in her home country, Uganda, and enjoyed her spirit and enthusiasm. Please welcome with me the one and only Winnie Byanyima.
Thank you. Thank you and congratulations on organizing this very important meeting, the World Health Summit. Excellencies, distinguished ladies and gentlemen, there is a wonderful German saying, der Gesunde weiß nicht, wie reich ist. I hope I got it right. The healthy one does not know how rich he or she is. There is nothing worth more than health. The COVID-19 crisis has shaken everyone and upended everything. We won't see a fast resumption of everyday life, and we won't be heading back to normal so soon. The good news that I have to share at this important summit is that the experience from the AIDS pandemic provides us hope. That hope, however, is not found merely in the passage of time or in easy tweaks. AIDS taught us, and COVID is reminding us, that only bold and radical policy action and major resource shifts can get us out of crises like this one. Nothing less than that can work. So, here are some lessons also. First, a global pandemic must have a global solution. We learned that from AIDS. People were dying and the world was in despair until the United Nations brought the world together and agreed to have a global HIV response, which led to the successes we are seeing today. Even without a vaccine, even without a cure, we have 25 million people on life-saving HIV treatment, living full lives. I'd like to take this opportunity to thank Chancellor Angela Merkel and the German government for their global leadership in this crisis, recognizing that it's a global problem, needing a global solution, and standing in to lead a global solution. Second, we need, as governments and international institutions, to open space for communities. This is an important lesson from the HIV response, not only for the communities to express their concerns, but to be part of shaping what is done. The most important drivers of change leading us out of the AIDS catastrophe were not those in authority. They did their part. It was those most affected who brought ground level insight, who pioneered practical innovations, who spoke truth to power and held leaders to account. In a crisis, you need more community voice and power, not less. Affected communities sit at the heart of UNAIDS governance and at the core of our work. We are special in the United Nations system to have civil society sitting on our board and guiding our work, including people living with HIV. Their first message to us here at this summit, they've asked me to say to governments, to major stakeholders, open the doors. The third lesson, we need to organize the development and production of COVID vaccines, tests, and treatments, recognizing that they are global public goods. Those who do not learn history are doomed to repeat it. We saw this when antiretrovirals had been innovated, discovered, and were on the market. People in developing countries experienced 5 years at least, more than 10 million lives lost to HIV as they waited because of the current system, monopolistic system that relies on patent hoarding and price gouging, that puts intellectual property protection over the right to life. We must change that. We must put people first. That's why we need a people's vaccine. I'm proud to be part of a diverse and global alliance calling for a people's vaccine. Together, we believe that there must be safe and effective vaccines for everyone. Vaccines that are fairly and speedily distributed across the world, free of charge, according to need and not ability to pay. To do so, first, we need to maximize supply. No single pharma company can make enough vaccines for the world. We need to unlock huge manufacturing capacity for the vaccine. To do this, all pharma companies must openly share their know-how and technology for producing their vaccines free of patent and monopoly. This know-how and technology, which has been paid for by many rich governments, can then be shared with as many producers as possible. Once we have more producers, we have more doses, and there will be no need for this self-defeating vaccine bidding war in which the most at risk will always lose. For this to work, first of all, we have innovated. The WHO has shown us how access pools work. For example, with the medicines patent pool. We also welcome COVAX, another pool, but we need its spirit of solidarity to extend to sharing technology and intellectual property for the global public good. For this, we need more investment in vaccine manufacturing in more regions of the world to supply the people in this pandemic and be ready to serve them again in the next pandemic. The access to COVID-19 tools accelerator, ACT Accelerator, has been set up on the understanding that no one is safe until everyone is safe. We need massive simultaneous production of vaccines, treatments, and tests across regions and across producers. The fourth lesson, we need to organize financing for healthcare in line with the recognition that health is a human right and a collective responsibility. People in developing countries spend $500 billion annually, over $80 per person, out of their own pockets to access health services. Millions of them sink into poverty because of paying for medicine, for treatment. User fees across most of the low-income countries and lower middle-income countries are the most regressive way of health financing. They are a tax on the sick that increases morbidity and mortality and exacerbates poverty and inequalities. And in this job crisis, access to health needs to be delinked from formal employment. Fragmentation in healthcare delivery is expensive, it's inefficient, it's ineffective. Now is the time to step up public investment to ensure universal public healthcare that includes publicly funded, community-delivered services. We would need taxation, progressive taxation that is reasonable and affordable. We would need from businesses, and we would need the wealthiest individuals to take a higher burden of tax, progressive taxation. And of course, we would need to have the richer countries coming out in the spirit of global solidarity to support the strengthening of health systems in the developing countries. Many developing countries are spending today more on debt repayments than on health and education and social protection. That can't be a way out of a pandemic, because now they are also facing austerity with the economic destruction. The recent 6-month extension of the Limited Debt Service Sustainability Initiative should be transformed into an agreement applicable to all developing countries and all types of lender, including multilateral and private lenders. We face a choice between life and debt. We need to look at other ways to expand the fiscal space for the developing countries to be able to cope with this pandemic. Fourth, fifth, and last, we need to challenge discrimination and exclusion and protect everyone's human rights. We can see how this pandemic has shown us how xenophobia, racism, bias, discrimination, abuse of human rights of minorities, LGBTI, sex workers, migrants. We've seen the most vulnerable people facing more persecution in the middle of a pandemic. We must stop this. We must assert human rights that are enshrined in the United Nations Convention. We can see how COVID has exacerbated crisis within crisis, worsening gender inequalities, exclusion from education for girls, child marriage is increasing. The COVID crisis risks undermining progress also on AIDS. HIV and COVID are two colliding epidemics that must be addressed together. I must insist on this because we're seeing in some countries desperate governments taking from one epidemic to fight another. This is not an answer. From the right to health to the right to education and the right to organize, all human rights must be at the heart of the response to the crisis and of ensuring public health. We can't beat COVID-19, we can't beat inequality, we can't finish the unfinished business of AIDS and also repair and restore the global economy, but only with a people-centered, public health, rights-based approach. And that requires boldness. Thank you so much for this opportunity.
Thank you so much, Winnie, for your great speech. And we are all very much looking forward to going back to Kampala, Uganda, for the next regional meeting of the World Health Summit, jointly with Charles Imigira, our Ugandan president, and the wonderful Lake of Victoria. Thank you so much. Now, Excellencies, ladies and gentlemen, dear friends, I'm happy to announce the next speaker, Nanette Kosiro, the global president of Pfizer Vaccines. She is leading the development program and for innovative vaccines, and she is driving the prevention of several serious and life-threatening conditions. And of course, the focus today and hopefully, and I'm sure in the company, is the coronavirus and the vaccine against the coronavirus. Let us listen to Nanette Kosiro.
Many thanks for the kind introduction, Professor Gunton, and hello to our distinguished audience. Thank you to the World Health Summit chairs and committee for inviting me to join this esteemed group of international experts, and special thanks to Dr. Tedros and to President Steinmeier and the host organizing team. I am truly honored to be here with you today. Like many of the other speakers today, I see myself as a global citizen. I have lived and worked in different countries and cultures, and I've been privileged to spend time in nearly every corner of the world during my tenure at Pfizer. And this global perspective has never been more relevant or valuable than right now, the most pivotal moment I have experienced since I joined Pfizer more than 18 years ago. I know, as both a scientist and a healthcare business leader, that only with real global collaboration will we be able to solve the unprecedented crisis that the COVID-19 pandemic represents. At Pfizer, we recognized early that this was a global challenge unlike any other we have seen in recent history. And as one of the world's premier innovative biopharmaceutical companies, we immediately mobilized to research new medicines and vaccines to prevent infection and halt further spread of this disease. As our CEO, Albert Bourla, has said, if not us, then who? In March, less than a week after the WHO declared COVID-19 a global pandemic, we announced our partnership with BioNTech on a potential messenger RNA-based coronavirus vaccine. We also outlined a 5-point plan calling on members of the innovation ecosystem to unite with us in this fight. We committed to share data and insights, technical expertise, and manufacturing capacity, and we are delivering on each of these promises. The spirit of collaboration that has quickly evolved is a testament to the industry's willingness to step up and play our part to combat this terrible pandemic. I know my fellow speakers here today join me in understanding that safe and effective vaccines will be especially critical to defeating COVID-19 virus. We know this because vaccines are the single most innovation in the science of health, second only to clean water in reducing the global burden of infectious diseases. On average, it takes a decade to develop a vaccine. So I feel truly encouraged that according to the WHO, more than 40 COVID-19 vaccine candidates are in clinical evaluation. This is staggering progress made possible only through the dedication of thousands of scientists working together to conduct the clinical trials and the many thousands of people who volunteer to take part in the research. We owe each of them a great debt of gratitude. The phase 2/3 trial for our COVID-19 vaccine candidate involves more than 130 clinical trial sites and nearly 40,000 participants in 5 countries, including Germany. As we continue to move with speed and urgency, the safety and well-being of vaccinated individuals remains our most top priority. Together with 8 other companies, in September, we announced a historic pledge to uphold the integrity of the scientific process as we all work at the speed of science towards a potential global regulatory filings and approvals of the COVID-19 vaccines. We made it very clear that we will in no way and under no circumstances compromise safety standards. We will not cut any corners. It remains vitally important to reinforce this message, both as an industry and in partnership with governments, patients' organizations, and medical institutions. It's also important that we continue to prioritize vaccination against diseases that are already preventable to help protect the most vulnerable among us, from newborns in maternity hospitals to older adults for whom illnesses like seasonal flu and pneumococcal diseases pose a serious danger. Disruption of immunization services, even for brief periods, will result in more susceptible individuals and raise the likelihood of outbreaks for highly contagious diseases like measles. This is why guidance issued by the WHO specifies that immunization services are an essential component of health services and should be maintained as long as pandemic response measures allow it. I truly believe that following the impact of COVID-19, the value of prevention in healthcare is now better and more widely understood than ever before. So it's crucial that we build on this momentum to ensure disease prevention and that it becomes a higher priority for governments and healthcare systems across the world. This means greater investment in vaccine innovation and a renewed focus on routine vaccination schedules and vaccine uptake. Unfortunately, we still see many countries that vaccines are not being fully utilized to achieve their greatest impact across the life course. For instance, this year marks 10 years since the WHO and European Commission introduced flu vaccination coverage targets of 75% for people 65 years and older. However, only one country, South Korea, is meeting that target to date. To drive progress, we urge governments and health systems to prioritize and support access to existing adult vaccines for respiratory diseases. In particular, we recognize the importance of protecting those at higher risk of morbidity from infectious disease, those with a weakened immune system due to underlying medical conditions. With a possible reduction in hospitalizations from these respiratory infections, healthcare resources can be directed to the continued management of the pandemic, especially during the winter when pressure on health systems will peak. COVID-19 has shown a light on the need to establish effective health policies that focus specifically on the aging population and find new ways to address the common barriers that we know exist for older people to get vaccinated. For example, pharmacists have for years been an underutilized health resource in many countries. Today, they stand ready to take on vaccination to help protect their local communities and strengthen health systems capacity. This is in line with a call issued by the International Pharmaceutical Federation at the World Health Assembly to authorize expansion of pharmacists' scope of practice. We ask that governments update legal and regulatory requirements to enable pharmacists to vaccinate eligible adults against all vaccine-preventable respiratory diseases as recommended. Pharmacist-led efforts in the community have been shown to increase uptake, especially for older adults who face accessible issues or difficulties in scheduling appointments in other settings. I feel optimistic that doors are opening to have conversations about leveraging every tool at our disposal to combat these challenges at global health community. I'm inspired by the vision statement from the WHO New Immunization Agenda 2030, imagining a world where everyone, everywhere, at every age, fully benefits from vaccines for good health and well-being. The time is now, and many of us head into winter season with a second wave of the pandemic emerging in many countries. 2020 is the year we have shown we are indeed stronger together. And I can help but wonder what strides we can make on other infectious diseases if we can sustain this high level of collaboration. If there's one message I like to leave everyone, a take-home message for today, is that prevention is everything. We must act now to establish policies and build infrastructure that work to prevent disease, to reduce health disparities today, and to build sustainability of our health systems in the future. Thank you for your attention and for the opportunity.
Thank you so much, Dr. Kocera. Yes, indeed, together we are stronger. Ladies and gentlemen, excellencies, dear friends, thank you so much for participating in this digital opening session of the World Health Summit 2020. It was different from previous years, but I believe we had extremely interesting messages to listen to and a lot of food for thought. In normal years, we would now have the great pleasure to invite you all for some good real food and drinks after the sessions. This was always an opportunity to meet old friends and new colleagues. This year is special, as we all know. Please join us again on Monday and on Tuesday for the program. Inspiring speakers, fruitful discussions will wait for you. See you virtually at the World Health Summit 2020 tomorrow and the day after tomorrow. Thank you very much and good evening